Hi everyone, my name is Phyllis Caves and my proposed change is postpartum education for new mothers. This means that I would like to create a standard education for all new mothers on the birth center. I would do this through creating a standardized checklist and using resources such as the Competence Assessment Tool, Postpartum Depression Risk Assessment, Safe Sleep, and Shaken Baby, along with a general resource sheet. I would complete this using the LEARNS model to help staff become educated through use of didactic days or super users. During this education, I would go over the checklist and explain all the different topics that needed to be covered. Also explaining what the Confidence and Postpartum Depression Risk Assessment are. Those are tools that will help better understand how confident the new mother is or if they're experiencing any postpartum depression. The postpartum depression risk assessment is very important because many new mothers won't be screened until they either follow up at their pediatrician or their OB, and those follow-ups either occur 1 to 2 days after discharge or a week to 6 weeks depending on the type of delivery that the new mom had. It's very beneficial because it allows the new mother to kind of get a baseline of where they're feeling with their depression, and it gives them a chance to see the types of questions that'll be asked, so that way when they follow up at their appointments, they can kind of compare to what they did on the one in the hospital, like, oh, I remember answering this question, I'm feeling better or worse than I did when I left. So that can be very helpful for the patient also. The hope with creating this education is that we would improve the new mom's confidence in caring for the infant, reducing newborn emergency room visits or urgent care visits, decreasing complications with feedings of the newborn, early detection of postpartum depression, and increased care of the newborn with sleep patterns. So the Shaken Baby and Safe Sleep are forms that we currently already use on the unit, so those would be easy to just keep implementing because our staff's already very comfortable with using them. The confidence in postpartum tools is things that would be taught during the education using the LEARNS model with our staff. And then the resource sheet is just another handout that you can give the new mom that goes over resources for breastfeeding, new mother support groups, another thing for postpartum depression, and WIC, which is a very common thing that we fill out for our new mothers. A lot of new mothers need WIC, so on the resource sheet it just kind of continues to follow up with them with what else they need to do to keep moving along to get the rest of their paperwork done. In the hospital we only give them one piece of it, so on the resource sheet it also highlights all the other things that they need to complete to finish getting signed up for the WIC program. So hopefully through the implementation of the standardized education, it will improve all of the stated outcomes, but also on our unit on the birth center, we get a lot of poor feedback about our discharges, saying that they feel rushed or they don't feel properly educated. So not only is it great for the parents, but it also helps with the birth center's scores in having a set education that will cover all the topics that new mothers need to learn. Thank you, and that is my proposed clinical change.